Okay, my name is Init Kawala. I'm a senior graduate fellow at Western University, and I'm also a partnership administrator for the SEED Global Health Partnership, and we basically look at maternal child health and emergency care. So we are looking at training health workers and health and students in on how they can help us to reduce the mortality due to pre-eclampsia. So as one of the the emergencies of the obstetric emergencies we have at Mbale Regional Referral Hospital, and just like Dr. Mugaba has said, it's one of the leading causes of maternal mortality and morbidity within the Elgon region. So the prevalence is still high, and we are advocating for more support towards helping us to reduce this prevalence. So according to the studies I've done, or the study that I'm currently doing, just realize that most of the mothers have preferred to seek care concurrently, traditional health care, traditional care from the traditional birth attendants and witch doctors, at the same time also going to the facilities. So here is a scenario whereby maybe I may get pre-eclampsia, but try to consult a doctor at a health center, but at the same time go to a traditional birth attendant, okay? Because why am I doing this? It's because I'm ignorant of what the cause of pre-eclampsia is. So I'll try all alternatives so that I get the care. So in case I go to a TBA and it works out, then that will be my referral point. In case of anything, a TBA. In case of anything, a health center. So what we've realized is that most of the mothers in the community seek care from both the traditional and the health centers. And those that are seeking care from traditional birth attendants, first to go to the health centers, and if the situation goes out of hand, they come to the traditional birth attendants and traditional healers. So one of the leading causes of why these mothers with such conditions are going there, one is because most of them were informing us about the poor care they get at their health facilities. It's not care poor as in terms of it being poor, but they expect a lot of care at the facility which the TBAs are providing. They go to the TBA, they find a flask of tea with the tea leaves there, majani, what they call majani, and then these TBAs even wash for them their blood when they are done with giving birth. They give them these medicines or local drugs at a cheaper cost, and yet when you come to the facility, she will claim that a health worker will look at you at labor suit seated on a bench, passes you first time, second time, the third time she comes back, she's like telling you to go and call an attendant, okay, to buy for you a cup of tea. But at a TBA, everything is there. So they really really looked at some of these things as being better than coming to a facility. However, when the situation goes out of hand at the TBA, they come to the facility. There is a condition called the machiro. Machiro is what we are looking at as pre-eclampsia. And I've seen the way TBAs are handling it is different from the way us at the facility, the way it is handled at the facility. And the way TBAs are handling it puts more of these mothers at risk of other complications than being handled at the facility. So most of the mothers who get what we call machiro in the community are being given very funny things like paraffin, applying this paraffin on them with sugar and dust. However, we realize that most of the TBAs manage pre-eclampsia differently. Whereas someone mixes paraffin with sugar, applies on you, and then covers you, other TBAs will mix the paraffin with some little soil and water and give it to you. Whereas at the facility, it will maybe managed better than the facility. Though, majority of the mothers who have gone through the TBAs feel this is a proper remedy than the facility where they will come and mix magnesium sulfate very fast, and what sometimes they are claiming that it may be even out of stock. You're forced to go to the to pharmacies and buy it over the counter, bring it. But by the time you think of moving here and there, a mother may die. So for them, they really feel going to a TBA who has all the solutions with her, just in her house, is just a plus. So people in the community have preferred these traditional medicines or traditional healers because of the swiftiness, okay? the care they are giving them, okay? And then when it comes to availability of services, it's rare to find a TBA telling a health worker, go and buy a glove, because they have these gloves at home, which is quite different from the facility. But in conclusion, okay, we recommend all mothers to give birth in the hands of a health worker. We recommend all mothers to go to the facility during antenatal. Okay, mothers are going to TBAs or traditional healers, okay, to get antenatal, and I've seen this. But when they go there, what do they get? I can't give you the concoctions that they take, but it's a concoction of several things, which predisposes them to other diseases that we don't understand. So mothers out there, please, these health facilities and doctors are trained to treat you. Why would you opt to go for a local alternative and then you go to the facility after the situation has gone out of hand? And these TBAs are telling us the fact, they've attested, they've told us mothers are dying in their hands. Why would you prefer to die in the hands of a TBA? You get it? Can you seek proper care from health facilities? So that is my humble appeal to mothers. Let's avoid taking risks. Let's avoid try and error, okay? Because you are looking at these local options to save a mother, but are they saving? Okay? And if they are saving, what are the long-term benefits? Because majority of them have really told us that after getting these concoctions from the TBAs, after delivery, postpartum, they are getting postpartum complications, and yet after that they go back to the facility. So we request mothers, please, okay, we know some facilities are a little far, but yeah, let's move to the facilities and get proper care. Thank you so much.